Dr. Mascarenhas, what are the signs and symptoms of PV, and really what can people expect as they live with this condition?
So, one of the themes I would say is that there is no uniformity in how patients present and behave with these diseases. So, some patients have no signs or symptoms. They really are asymptomatic, and they're found by an astute clinician who sees that something is, awry with the blood testing, and then pursues an investigation, usually with a JAK2 mutation to demonstrate that there's abnormal cells. But sometimes patients do present with clots, and the clots could be anything from clots in the leg, so it could be swelling of the leg and pain in the leg. It could be difficulty breathing, clots in the lungs, heart attacks, strokes. Abdominal clots can sometimes manifest as bloating and discomfort and pain. But if you ask what's a less dramatic presentation, a more protein presentation, I would say it's often itching, and interestingly, it's aquagenic pruritus, meaning water-induced itching. It's one of the only diseases I'm aware of where patients will say, I take a shower, particularly a hot shower, and it can be quite miserable. I get very uncomfortable. I'm itching. Sometimes they'll say their skin feels like they're on fire. Some patients present with a lot of headaches, as we discussed previously, and that can be sometimes years and decades before the diagnosis. Other patients feel very fatigued, and it's the kind of fatigue that kind of hits you in the afternoon, and patients sometimes have to nap, and that can be quite disconcerting, particularly if you lead a busy life. And then patients can have anything from abdominal complaints like bloating after eating, some pressure in the left upper quadrant from spleen enlargement, to reflux, to even neuropathy and Raynaud's, where they go into the cold section in the freezer and all of a sudden their fingers are turning white and really hurt. So there really is a wide range of symptoms that not every patient has to have, and some patients don't have any of those symptoms. They're asymptomatic, but then you can meet patients that have all of those symptoms or a few of those symptoms very severely. So what's really interesting about PV is it is not, even though it's a mutation in JAK2, which all the patients have, the clinical features and phenotypes can really vary.
Excellent. Yeah. Can you tell us why it's so important to track those symptoms, whether it's a new symptom or, the frequency of when patients experience this symptom starts to go up? Why is that so important?
Well, I think it's important for a lot of reasons. And we recognize, obviously, that quality of life is important to patients, and that if you don't ask the questions, and there are symptom assessment forms that one can use to go through, some of the classic symptoms in PV. But if you do a good 12-point review of systems, you'll pick up a lot of the symptoms that patients have, and that can sometimes dictate treatment decisions because, patients who are more symptomatic, particularly if fatigue is starting to impair functionality, if headaches are starting to limit activities, whether it's social or work-related activities, that person is not going to do well. So it's not even just quality of life reduction, its outcomes can be compromised from having symptoms. Patients may be eating less, they're losing weight. Patients are having such bad headaches, they're not able to take care of themselves in the way that they should. Maybe social engagement starts to become very hard, and they start living more isolated lives where they can have more complications. So I think understanding the symptom burden is important because you want to optimize the overall sense of well-being for the patient, but also the outcome of the patient. And symptoms also can drive treatment decisions or even drive patients off of a treatment. A treatment that might be adding or worsening their symptoms may not be the appropriate treatment for that patient. So it's important that patients report their symptoms. And I always beg patients, don't don't filter what you have based on what you think might be. Just report your symptoms and let the physician sort of sort through it and figure out whether it's PV related or not PV related, because you'd be surprised how many symptoms could be directly and indirectly linked to PV, and you don't want to shortchange yourself by underreporting your symptoms either.